All right, welcome everybody to our pet talk this evening, Pet Massage. My name is Amelia Curtis and I'm the education manager here at San Diego Humane Society. We've been hosting our pet talk series virtually through Zoom for the past few months, almost a year now, and we've had a lot of people enjoying attending from home, having your pets join in, and learning about pets with your family and friends, and just having an opportunity to be around other people who enjoy learning about pets. So thank you all for coming this evening. I'm going to go ahead and share my screen. And I'm going to show you guys just some events that are coming up and show you some animals that we have available for adoption currently. So our events page is a great page to go to. If everyone can see right now, it should say sdhumane.org/events. But I'm going to show you guys tonight how to get to our pet talk page so you can see all the pet talks that we have coming up. I've been booking them as fast as I can, and I'm trying to book around 2 a month so that we have lots of great topics for you all to enjoy. So if you go to sdhumane.org and hover over programs, you'll click on that very first thing, which is activities and learning. And then if you scroll down, Pet Talks is here. It's at the bottom of this heading. And this is our Pet Talk page. So it lists all of the different Pet Talks that we have coming up. So this month, we also have a really exciting pet talk. It is called Humane Law Enforcement, a look inside animal hoarding cases. So we have some humane law enforcement officers who are going to talk about some of the cases that we have had here with San Diego Humane Society, and things that you can look for in your community and how you can help out as well. So it will be really informative, and it'll be really interesting. So this lecture is on a Saturday morning. So to find out the time and to register, you would just click up here, which says calendar, and it'll take you to the month we're currently in. Always, if you want to scroll forward, you just hit the button of the arrow going forward. So this lecture is on the 27th here, and it is, I believe it is at 10 a.m. So if you'd like to register for that, I'll also be sending out a link, but I just wanted to show you some of the fun activities that we had coming up. And let's see. Next month, also, we have our animal communicator who's going to be talking about animal communication and energy healing. So if you'd like to learn more about that, it's a really exciting lecture as well. So I'll send out some of those links for you guys so you have that. But first, I just wanted to show you some cute animals we have available for adoption right now. So this is Maya. She's 4 years old, and she is a German Shepherd mix. She has that really pretty dark coloring on her face and her back. And I believe it says here that she's a little bit shy when she first meets you, but then she warms up really well and is so happy to meet people. So this is just a little bit of info about her if you're interested in helping us spread the word about her. And then I don't know if we have any fans of pet rats here, but we have a really cute one named Remy, and he is just really cute, and I think would be great if you could help spread the word about him as well, because rats also need a home. They're really, really smart, and they can be really fun pets to have. And his bio and information's all right here. So I'll send links to those guys as well for you. So I am going to introduce our speaker this evening. We have Nedra, and she has been speaking with San Diego Humane Society for many years now, and she will be talking about pet massage this evening, and she'll tell you about some of her other specialties that she does. She has a lot of knowledge in other areas as well, so she'll probably go into that a little bit and what she does. So we are going to share her presentation now. Nedra will be doing demos while I am clicking through the slides. If you have any questions, you can feel free to either put them in the chat, or while we are talking, if you feel it's relevant to the moment, the topic that we're on, you're welcome to unmute yourself and ask in that moment. So I'm going to start the slideshow here. And Nedra, you can go ahead and take it away.
Hi, I'm Nedra. I am nationally certified in small animal and equine massage and acupressure and Reiki. I also am certified in essential oils and nutrition as of recently. But tonight, we're just going to talk about massage. And we're going to go through kind of the origins of massage, why we do massage, how it helps your pet. And we're going to show you some positions you can do on your pup, you know, for calming, for, you know, some pain issues and just whatever's going on in their normal being. Also, we're going to talk about kind of what you're feeling when you're kind of petting your pet. You can like look for certain things like heat distribution and things like that. That just gives you clues as to what's going on in the body. Next slide. Okay, so the history of massage, it's been around, first documented description of massage was dated back to 3000 BC, and it was discovered in China. And Chinese Taoist priests were utilizing that basically through Qigong and movement through meditation, which they called massage. And then basically Japanese monks came out and started learning that and brought it back. And then from there, that's where we kind of got shiatsu, which is kind of the origins of acupressure, acupuncture, and massage itself. Next slide. So you're going to get this presentation because there's actually some fairly interesting information if you want a history of massage. The most important thing is that in 2700 BC, animal massage was documented in China. In the United States, it really became utilized because of the horse racing. And the first time it was used, equine massage was officially recognized in 1970. So fairly recently. And from there, watching what people were doing with horses, it then became more mainstream, and then people started using it on their pets as well as obviously humans were doing this before them. But the history of basically massage dates back to ancient times. First known documentation was 2700 BC in China. Massage techniques were used to develop throughout history, and they were used in writings for the Greeks, Romans, Egyptians. So touch has always been utilized throughout time, and they've always had good results. Julius Caesar traveled with a personal massage therapist for his war dogs just to keep them healthy. And then obviously with horse racing, and then we're kind of where we are today. So canine massage has actually become really popular, and they're using it in vet offices now. And there's a lot it can do, and it's not just physical. There's a lot of emotional things massage can do, as well as calming down your pets based on kind of the length and duration of strokes that you're using on your dog. And it also just really creates a really nice bond between you and your pet. And that's probably one of the more important things. So why massage for pets? In the wild, social grooming, dogs and cats are in the wild, they're basically they're licking, they're touching, they're doing things, and all that actually kind of stimulates the fascia, it stimulates the nervous system. Obviously mothers, when pups are born, they're licking their pups to get them moving and actually removing fascia and chi neurons when we do that. Because our pups are more domesticated now, actually you can go to the next slide. Yeah, you go? Good. Oh wait, one more after that, sorry. One more. You right? Perfect. No, one more. One more. There. So the benefits for massage, they basically parallel humans. They found that touch research was initially proven with lab animals, which isn't great, but animal experiments evaluated the physiological effects of massage, and those began as early as 1800. There's a Touch Research Institute, and they started talking about the investigations of the importance of tactile stimulation, and they used rat pups for this as their subjects. At present, studies are being conducted which animal models to track involve the biological process of touch. In addition, the Chinese have produced numerous studies documenting the effect of Eastern modalities on animals. And by extrapolating to humans and continuing the studies on bipeds, researchers have provided evidence of many benefits of touch and massage. So it really parallels humans. So if you go to get massage, obviously it's really relaxing, you release a lot of endorphins, it really can get toxins out of the body. So depending on what we're using it for, it has a really nice preventative effect. It can help if something is wrong. It's also really nice to use in, conjunction with Western medicine as well. So we'll go to the next slide. One of the most important aspects of massage with you and your pet is just knowing your dog's body. And that really can save you a lot of trouble. Because if you're constantly touching your dog or just running over them lightly, if all of a sudden you notice a lump, like if you weren't doing this, you wouldn't notice that. And that really kind of prevention really is a huge deal. So if you can catch something when it's small, it may just be a lipoma, it may be something else, but just knowing it's there. Because in reality, your vet sees your pet maybe once or twice a year if they're healthy. And if you can kind of, come in and be like, hey, this is new, it just developed, that's something, they can ask for it, they can do things with that. Also, it really helps just working, like I've known Nad for a long time, and I just I'm touching him right now, and I realize he's lost some weight, because like you can kind of see like where their ribs are, where their hip bones are. So just kind of knowing how your dog is doing and feeling, it just again gives you that first line of defense if something's wrong, or if your dog's kind of putting on weight. Sometimes you can see it, but sometimes if they're super fluffy, you can't. So just knowing what their normal is super important. The other thing that's good to check, if you put your hand on your dog's head, sorry, he hates this, I know. Feel how hot it feels or how cool it feels, and then run your hand down the entire length of the body. And ideally, not COVID, ideally, it should be a pretty even temp. It could be all kind of warm, it could be all kind of cool, or it could be whatever that is. What you're kind of looking for, if there's like kind of blockages, like if his head's super hot, like some dogs really live in their head. So like they run hot, they're like really active, they're always looking at stuff, their heads tend to be super hot. But if you kind of run your hand down, you'll notice that their body's actually a lot cooler. So something you can do just by literally stroking really lightly either side, it's called an Upthrust Stroke, we'll talk about it, but you can kind of pull that heat down. And that really helps balance out your pup. So if you have like kind of a hyperactive dog, or just who seems like kind of intense, this is just a nice thing to do for them when they're in a calm, quiet position. But just also you can know, like, what is your dog's normal? Like some dogs do run warm all the way through, that's fine. But if you're noticing like warm, cool, that's something you want to try and even out, which you just, again, would kind of run through. You can obviously use acupressure for that as well, but just by doing this, you kind of even out the body. Because the minute you touch your pup, you're stimulating fascia, which is all over the body, and neurons, and you're already making a change. So it's just kind of something you guys can do to help out your pup. Overall health boost. And again, another really good thing is like touch especially is a really good bonding point for you and your pet. So just by like kind of doing this, like you're establishing a bond with your pet, especially if anybody has gotten pandemic puppies, touch is really important for puppies to get used to it, because you like literally play with their paws, play with their stuff, put your fingers in their mouth, just watch their sharp little teeth. But the more you can touch your dog and kind of move them around, the easier it is for a vet to examine them. So just by getting them acclimated to touch, that touch is a good thing. It really can help like with vet exams and things like that, and taking some of the angst out of that, or just having them used to touch. Even like if a lot of times, like it sounds weird, but like if you want to brush your pup's teeth, the first thing you can just kind of just start putting your finger in their mouth. Just make sure they don't bite you. Some dogs are okay with it. If they're not, don't do it. But then you can just get like a little bit of toothpaste with like coconut oil and a little bit of baking soda, and put that on your finger. You can kind of just start kind of massaging their gums and like rubbing their teeth. And that, again, oral health is a whole other issue, but it's really important. So the more acclimated they get to that, you can probably get a little brush in there at some point. But it's just introducing all these things to them, in moderation when they're younger, just really sets them up for more success as they get older. And next slide. So what can massage help? Really good for stress reduction and relaxation. Also really good for moving like in soft tissues, like getting flexibility, especially if you have an older pup. There's a lot you can do just to kind of move, like get blood flow in, work with friction. On our older dogs, we do a lot of massage because their flows aren't always as great, but we can kind of get them to do that. If there's edema or swelling, obviously you're going to their vet if there's an issue, but there's ways you can kind of work that out just so they're more comfy. You can kind of play with their posture and their balance, and there's some things you can do with massage, because you can kind of tone some things and loosen things just to keep them on kind of a narrow. If you kind of look at your pup, if your dog like has kind of curves, or he has a curve on his back,
usually that means they're way too tight back there, but then like, it's like a kind of a bow and like at the string. So the bow is too tight, so the string's too loose. So you can kind of, you want to open up that so then you can just even them out again and get kind of that curve out of their back. So there's certain maneuvers you can do to help that. If you have an older pup, it's really important to get blood flow into the extremities, especially too, if you have a dog that can't always find its feet. Sometimes as we get older, we don't always like, you know, it takes a while to get up and they can't always like their feet may curve under a bit, which could be neuro. But just by like playing with the bottoms of their feet in the morning, it just kind of signals the brain that, oh, I have feet. And that way they can find their feet a little faster. And that really helps them out a lot. If there's like scar tissue, what they've noticed, like spay neuter, obviously we're doing that, but it does create a scar. So kind of getting in that area after a little couple of weeks and just making sure it's smoothed out, because even if it like tightens by a centimeter, that can really affect the hips and how they walk later on. So you always just kind of want to keep everything very supple, and you're not using a ton of pressure for that. It's just you're kind of moving it around a little bit and playing with it. Male dogs, that's kind of a different situation, but you can kind of work the hip area at that point if they're doing that. Obviously, it releases endorphins, is really good for calming. If you have an athletic dog, it's really good, especially if you're doing dock diving or I forget the other one, but where they kind of slam into the board. If your dog does that, oh, fly ball. If your dog does fly ball, A, come see me, but B, make sure, we'll talk about it, but you want to really work out that shoulder area and you want to work out back here because they do that turn. And a lot of times this can get really tight and upset. It helps with digestion actually. So a lot of times if your pup is having trouble with immune intake digestive enzymes, talk to your vet, but there's like a lot of this, you can just stim it, which gets your tummy moving, which just helps them absorb things a little better. Obviously lengthens tissues. And especially with emotional well-being, if you have a stressed out dog and you can get them in a calm place and kind of start with this, just to get, you know, the cortisol down and the endorphins up, really can make a big difference. So we're going to talk about 1, 2, 3, 4, 5. We've got 6 strokes we're going to kind of go over. And there's an order to these for kind of a reason. But the easiest one to start with is called passive touch. So if you've got your dog with you, pretty much you just put your hands just right there. Good. And you're not using a lot of pressure. I'm just putting my hands here. And what I'm doing is I'm kind of just connecting energy. And I'm also just introducing myself to the dog. So this is just nice. And you can do it this way. But again, not moving, which is always hard for me, not really doing pressure, just really sitting here. And you can just take a nice big deep breath. And it's just really a nice intro stroke. And again, just by touching your dog, you're still kind of moving fascia and things like that. So you kind of start here, and then you just can kind of put your hands here, and you just do a lot of passive touch strokes. And you can hold however long he seems comfy. A lot of dogs, this is really relaxing for them because there's sometimes if dogs are more kind of on the high end of activity, like border collies, and you know those guys, a lot of Chihuahuas tend to kind of run high. This is a really nice thing to do for them, just because you're not moving, so you're just allowing them just to kind of decompress. So go to the next little slide. So even pressured, as we said, and the other thing we do, like kind of in between strokes, like if you're doing, if we're going to start doing some other strokes, so you notice your dog is getting a little agitated, you can always come back to this. So this is just a nice, really nice reconnecting point. If you're just sitting with your dog watching TV, this is a great thing to do. And even if you have a puppy, this actually works. Sometimes they'll kind of chill out for a while, but puppies tend to run up and down because that's their job. But this is just, again, a really nice stroke to have, right? Okay. And so with that, just make sure that you are kind of in a nice calm state when you start to work on your pups too, because that really allows them to relax, because they definitely will pick up on your energetics or whatever's going on with you. So if you just take a nice big breath, just kind of blow out your day, then you can start really working on your pup. So the next stroke is called an Upthrust Stroke. And this is a French word, it means to skim. So this is a really light stroke. And this is the one we talked about. You just can kind of use this to pull that energy down. And again, this is a nice calming stroke, right? Okay. And this, we want to do both the passive touch and Upthrust before we start doing deeper work, because this also will just wake up the body and kind of get the fascia moving, get some blood flowing. That allows us to do some deeper strokes. Right? Okay. And you can just kind of, I tend to run down with this. And again, we'll pull heat down. You can take it all the way down, like the legs, if they're okay with that. Sometimes if you can go to the feet, if it doesn't bother them. So this is just a nice stroke. And this is the one I use a lot just to kind of, you know, see what's going on with my dog. Like, you know, what I'm just kind of doing a check here. Like, do I notice anything? I was up here, I noticed he has a little lipoma that wasn't there before. So we'll let his
I
person
use
out.
that when I start to massage a horse.
Yeah. No, it's a really good one. And not with anybody, even like with humans, you can kind of do this. It's just, it really, if you're like little kids, this is a really nice stroke to use like right during bedtime. It just really can be calming for them. Because again, little kids tend to live in their little heads because they're young, and puppies do the same thing. They're just very yangy at that point. So you're kind of doing this yin yang. And eventually as they get older, unless they're labs, they kind of tend to even out. So
Nedra, can you just confirm that everything you're talking about so far is for all pets or certain pets? And then if there's anything that shouldn't be done with like a cat versus a dog, things like that.
Depending, and again, this is really based on animal preference. So all this so far, you can do this on your dog, on your cat, on your horse. With birds, I've done this, but I use like a little finger because they're tiny. Rats actually respond really well to massage. Pretty much, and snakes will do, you can play with your snake too, because I've worked on some snakes just really lightly. So really at this point, there are contraindications, but usually not to these two strokes. If you have a dog that has like an infection or has cancer or things like that, you really want to talk to your vet, because you don't want to kind of move a ton of energy depending on what's going on. In some situations you will, but as far as these two strokes, for the most part, you're good to go. And the only other thing you want to watch out for is if you have a pup, like say that's on medication, like, you know, Rimadyl or any kind of like painkiller, these strokes you can totally do, but sometimes you don't, like the dog won't register if you're going too deep. So on other strokes, you just want to know kind of if your pup's on medication, if they're on any kind of like a blood thinner. These two that we've just done are still safe, but this second round that I'm going to show you, you just want to be more cautious with those. And again, you would talk to like your vet or if you have a practitioner as well. Good question. Okay, so percutage is from the French word to knead, so it's like you're kind of kneading bread. These are applied pressure and they're a little deeper. They compress the underlying muscle. There's like kneading, wringing, skin rolling, and this is really good for muscle tissue. And this is where you're kind of pumping blood. And helps get fluid and waste products in and out of the muscle system. So if they've got really tight muscles, this should be used once the body is warmed up. So if you're going to use this stroke, you just want to make sure you've done your compression and you've done your the Upthrust. I know. So percutage, basically, a lot of it is just, it's kind of like this kneading, squeezing thing. So like on his, I move a dog, like, you know, their hock back here, their hamstring. This is always, especially for older dogs, I don't know if you can see, but kind of, I've got my hand on both sides of his hamstring, and I am just like, you know, I'm kneading it. And he seems, I'm using a lighter pressure, but just pay attention to your dogs. Like if they look back at you or they're just like, whoa, go lighter, or just go back to this one, because that will at least, you know, kind of put them back in a state. But this is a great one for our older guys. Good yawn. And yawning is actually good, slow yawns. So I'm just kind of kneading this, and this is really good. I'm just pulling muscle. I'm actually moving blood and things in here. So this is really great for like tight little muscles. The other one you can do is right up in here. I'm just kind of pulling the skin back, like you kind of open up your pec muscles. This is great if you've got an athletic dog or if you have a dog with back end issues, because dogs will weight 60% front, 40 back. But if their back end is not as strong, they end up putting a lot more weight up here. So you really want to support this and make sure it's getting some good blood flow, and you're opening it up so the shoulders don't get too cramped up, because they don't have a clavicle, they have like a little shoulder hammock. So just moving all this around is really good. And then the neck is another nice place, as long as they're good with it, just to do this. There's also this movement where I'm just kind of pinching lightly and I'm moving up here. And this just, again, releases a lot of toxins and fluids, if there is, and it just kind of opens all this up, and it's just a nice one. That when I'm going, there's another one that we do is called Pinchment, but this is a little deeper. So he seems good with this. So just again, always keep an eye on your pup. But this is a really nice example of that. Yeah, okay. And we want that, especially in our older guys, we want that pumping action to kind of, it also a lot of times if they're not moving a lot, if they're older,
it just builds up that, it gets that blood moving. It also kind of helps release toxins. So sometimes like you want to wait for like after surgery, but then this is another nice one just to kind of move things out of the body. Right. Okay, and then we have compression, which can go very light to very deep as like a deep tissue massage. And compression, normally if your dog has like a tight area or has had kind of scar tissue, you can use your hand, you can use a fist. I usually would just use open hand because you really don't need to go that deep. And you can use this kind of also over joint. So a lot of times like there's not enough synovial fluid, you can kind of just like, I'm on his little knee right now, and I can just take my hand and just push on this slightly, or I can take fingers and do that. So you can use compression for over joints. It's really nice because it gets things going. You can't always pick up the skin in that area. So that's really good. A lot of times with wrists, you can use compression. It's really nice if they're like wrists or elbows are sore. We use it a lot for that. And also if you do it like slowly, it can be really calming. And it basically kind of creates, it just makes it easier. Like another one under the shoulder blades, you kind of just can compress like right under, you follow like the back of it all the way down. You can use your fingers. If you have a littler dog, you probably want to use fingers versus your hand. Another nice place to use this is kind of on either side of the spine, because the longissimus muscle is the longest muscle, kind of runs from here all the way down. So if their back is tight, you just kind of go on either side of the spine and just do little presses. And that really kind of helps the longissimus muscle release. So that's always good if there's back end things. So we'll go with that for now. And let's see. And again, if they have a surgery scar, or there's some kind of like an adhesion, just putting your hand over that and just kind of basically putting pressure in, you can kind of slide it down. We do some stuff for that. So that can be really helpful as well. And then friction is what we do to kind of create heat in the body. So again, a lot of times after an injury is like healed and the scar tissue is kind of healed, we can use that. If you have an older dog, it's really helpful. This just stimulates circulation, it lengthens the muscle fibers, and it warms the tissue and it loosens restricted tissue. So there's several different strokes that are classified. So we have direct pressure, which is kind of similar to compression, but we're going to move instead of just compressing. So again, down the spine is really nice to use this for the direct pressure. It just opens that up. Good job. Another nice spot is if you have a pup with like some back end things or tightness, you kind of find the last rib on your dog. You can kind of feel that. And then you pretty much take your hand and just run it through and over the hip. And this is really good because there's the TFL and the psoas are kind of underneath all this. And by opening this up, the attachment points tend to be in the like hip area, the inguinal, and then in the knee. So if you have a dog who has like ACL, like tendencies or issues, just by opening up this muscle, it should feel like, sometimes it feels ropey or knotty. What you want to do is just keep doing this until it kind of loosens up, as long as they're okay with the pressure. But that really takes the pressure off the knee and the hip. So a lot of times my older guys are just dogs that have tight back ends because it can lead to like ACL and CCL tears. So just by doing this, you just kind of take the pressure off of it. Marrying them may not be totally preventative, but it's always a good thing to do. If I have athletic dogs, I do this a lot. He seems okay with it. So this is another nice stroke that I use, and this is kind of a friction stroke. The other one is like cross fiber friction. So again, you can kind of take, so like you can kind of follow the muscle that is linear. And if you've got like, again, just to kind of get blood flow going, you may not like this, but just go across the muscle because the muscle is kind of going this way. I'm going against the muscle. So this really creates some good heat. You can use this with the persiflage to get blood flow. So if there's like, you know, back end issues or like, you know, knee, leg issues, this is always a really nice stroke. And especially for our older guys, it's just in the morning, I usually have my clients do that because it just kind of warms them up. And that's always good. You know, if they're having trouble getting up in the mornings, doing this, and then you're kind of doing that friction on the bottom of the feet. But just like kind of doing cross fiber, just any kind of movement down here, especially for our older guys, because this synapses don't always fire as fast when they get older. So this really allows the brain to find feet. So this is kind of something I use a lot for my like senior guys or just, I know dogs that are kind of having some neuro issues. It's really helpful. Then circular.
Circular is another one. You can definitely kind of take this friction and go around. Sometimes we'll do it like on their little heads if they're good with it. We just kind of move this around. Their little skulls can get tight. So you can just do some linear like this. And then you can kind of do little circles up here. Another nice place to do this is at the jaw, at the TMJ point, because a lot of our guys have really tight jaws. So just kind of doing a lot of like their friction strokes that you're kind of doing percutage and friction, but just opening up this is really important. Like you can find the TMJ and just do little circles up there. Don't let them get mad at you though. Okay, sorry. But this is actually really helpful. And you always want to kind of check their jaw, their TMJ as well, because the way it attaches, that can affect the neck, which then can affect the entire body because everything's obviously connected. So those are just some fun little strokes. And again, with these, with percutage, with friction, you just want to make sure you've done your upthrust and you've warmed up the body before you're kind of getting in. And for the most part, there's no reason to go like really deep. I mean, you just kind of start, and even like if you've ever had a massage and somebody goes too deep on you right away, it hurts and you tense up. So you kind of just want to allow the body to let you in. And so a lot of times, like I'll start out and it seems tight, I'll just kind of work it slowly. And then you can kind of just feel that it just kind of releases. And then you can go a little bit deeper if you need to. Okay. And then Pinchment is one of, I think the last one we're doing. Pinchment really is, it's a Swedish use, it's a rhythmic percussion. So a lot of times at the end of a massage, they'll do cupping on you with their hands and they do this. I don't do a ton of that in dogs because I think it's kind of scary, but I use fingertips a lot. And this can really engage the central nervous system. So if I have a dog that's like literally crazy hyper, I'm not going to do it to him exactly, but what you do, if you literally just tap on their little head a little bit, it just kind of takes them out of it. So it just kind of brings them back. It's like, whoa, what just happened there? Because it kind of readjusts everything. But even if they just are having nervy issues, like this is actually really nice for them. Okay, you love it. But this is a good one to use and just kind of tap down the body like this. And it just kind of, if the nerves are overactive, a lot of times if there's a lot of pain issue, you're not going to work on the pain site, but just by doing this, you kind of let the nerves just like, they kind of cut them off. So the pain just will kind of subside for a second because you're kind of overloading the nervous system. So this is really nice to use. Cupping, obviously, with your hand, but I don't know, you can do this. I think I use this more on horses just because they're kind of bigger and I don't come down hard. I've just been kind of creating almost like more of a suction. And then the last one is pinchment. And this is really good for fascial issues. So not just you're kind of literally like you're doing little pinches, but it's really light. So I'm not going deep. I'm just like pinching like the very top of the skin and just picking it up a tiny bit. And this too kind of calms down the nervous system. It also stims the fascia because your fascia is really light and on top, and that allows like the whole fascia kind of controls everything because it's intertwined with muscle, with organ systems. So just by loosening up fascia, sometimes like if you've ever had an accident, like your muscles are fine, but the fascia is like way too tight. And that kind of doesn't allow the muscle to expand or do its thing. So like this is just really nice to release all that in your pup. I do this a lot with athletic dogs because they tend to get really tight. And so this just kind of allows that fascia to release and then you can kind of get in deeper into the muscle. Okay, so do you guys have any questions at this point? Questions? Okay. So for a massage session, basically, if somebody comes out or I come out, basically it's just like, we'll kind of do the following, just so an overview of the pup. So we're gonna like do visual observations, like how is the dog moving? What is its gait? What does he look like? You know, what does his coat look like? What are his eyes, ears, nose? We're gonna look at kind of the whole dog being, and just to kind of see what, like fur is really a good indicator of like, you know, overall health and skin and all those things. We just kind of look at everything just as a whole to see kind of what we're dealing with. We'll then kind of listen for breathing. Smell is actually a really good indicator of just kind of issues in the body. So like sometimes if their ears smell kind of yeasty or sweet, that's one thing. A lot of times if you smell your dog's feet, for whatever reason, if they smell like Fritos, that tends to be more of a yeasty issue. So just kind of just having observations, nothing's right or wrong, but we just like kind of want to put this whole thing together like a big puzzle so we can see what is the best, you know, what are the best strokes to use, what is going on with that. We will basically, you know, ask you what's your pet's day like, what are they eating, just kind of getting that big overview. food obviously is like, 90% of health with everything. So just kind of knowing that and getting that in balance really helps with the overall process. Physical exam, we'll look at obviously teeth, gums, coats. Just on a quick note, like if you're a pup, just kind of, you want to know a couple things just so you know them. But like if you look at Nad's tongue, it's a nice color pink, but that's his normal. But if his tongue ever got really white, that's a medical emergency. If it ever gets really purple, that's a medical emergency. If your pup is outside and all of a sudden you notice they're panting, but their tongue's getting super red, you need to get them inside. So there's just, the tongue actually can tell you a lot, but just like knowing normal gum color, normal tongue color, because some dogs run redder than others, but as long as you know the normal, then you know if there's an issue or not, if things really change. And that's also really helpful for your vet to know. But yeah, usually if their gums get super white, that's you're going to the emergency room, because that's not good. As I said, we'll observe gait and movement. Once we get this all completed, we'll kind of, again, it's very permission based with our pups, because they're not going to, sit there if they don't want to be touched. And we obviously want to make sure we're paying really close attention to, like, if they're yawning, licking or chewing, that's good. If they're looking at us like, whoa, like that's a sensitive spot, then we kind of take that into consideration. So your dog kind of runs the session to some regard, which is good, because we want it to be permission based, so like they have, it's their choice to be there. And just that way, it's usually if we're coming to your house, your dog's safe place, so you don't want bad things to happen where they live. So that's kind of what a session looks like. And then we just kind of determine from all this information what we're going to do. And then sometimes, like if if it's me, then I'll figure out like what strokes, like I can show, the pet parent, and that way he can use those, a couple times a week, just to kind of keep everything moving and just to keep the pup balanced. Okay. If you guys are interested in learning about massage, Northwestern School of Animal Massage is really good. They're up in Seattle, but I think they were doing classes, but I think they're doing some things up there. But it just gives you, you don't need to do it professionally, but just having some of these skills just allows you other tools to help your pup and just, keep them healthy. So just that really gives you, some role in this. So you can really be, proactive and just participate in your dog's health and well-being. And then number one rule, massage is a really powerful healing system. It's a wonderful complement to other therapies, but it's not meant as a substitute for veterinary medicine. So it's really important if you notice any kind of change in your pup's emotional well-being, if all of a sudden like they seem to get really grumpy, a lot of times that can be pain. They don't like touch all of a sudden. So again, just knowing your pet's normal is good. But any, like, if they're limping, obviously, if all of a sudden they're getting like cranky, there's breathing issues, like anything, you go to your veterinarian. And a lot of times they'll, because they have x-rays and they can pull blood and do all those things. And once you kind of have a diagnosis, then, we can come back in and then you can kind of support the diagnosis with be it acupressure or massage, or Reiki, or depending on what's going on. But just, people have called me. It's just like, if you think about, like, if you were having a heart attack, you're not calling your massage therapist, right? You're going to the hospital. So just always be well aware that, veterinary medicine is like the first line of first defense for these guys. And then questions.
So everyone can feel free to unmute yourselves if you have a question, or you can pop it in the chat and I can ask the question for you. It's up to you. Nedra, is this the last slide?
Yeah.
Okay, I'll stop my screen share then.
Okay.
I have a question, Nedra. How would you know if your pet is responding positively or not to what you're doing, if you're using
So a lot of times, like if they really, if they're not in the mood, like they'll get up and walk away. Or they can, like, if something like looks like it's hurting, like they'll look at you, like they'll usually like let you know. So then it's like, you're like, okay, that's a sensitive spot. So that's something you would think about. Normally, if they're like, calm, like they'll lay down, they'll like yawn, like or chew, or they'll stretch out. So we just kind of know, but usually if they're really nuts, like certain dogs, like sometimes they're just like, okay, like I've had enough of this, and they'll just get up and go. So dogs aren't really shy about that. If something's not, you know, what they want at that moment, they'll go. Sometimes they come back. Sometimes with like younger dogs, we're moving a lot of energy and chi. So sometimes they just need to kind of process and come back. And especially if they kind of run hot, like herding dogs tend to be like, they need more movement. So they don't like to sit still when they're younger that long. So we just kind of do it in little segments. But they tend to let you know.
Do you, and I may have missed part of your presentation, do you use acupressure or acupuncture?
I use acupressure. Acupuncture is vet induced, but it's the exact same points. So depending on what's going on, usually if I come out and do a session, I'm going to do some massage and I'll do some acupressure and some Reiki, depending on what's going on. But yeah, acupressure too is really good for faster for moving blood, for just like clearing out meridians and just helping organ systems. So it all works really well together.
Absolutely. And I am actually in the market to look for, and I know if you do acupuncture, you must be under supervision of a DMV or, you know, a
It's
vet.
actually acupressure, so no, I don't need to be, but I do work with a vet. But acupressure is okay on its own, as is massage.
Yeah, well, if you have a vet that does acupuncture, I would like to know it.
Yeah, Dr. Bissoni is really good, and he's in Carlsbad. And I think it's, I can get you like his link and everything else, but yeah, he's fantastic. And they also do VAM, which is a form of chiropractic veterinary. They use lasers. They do a lot of really like, he's integrative. He also uses herbs. So like, it's kind of just a good, I mean, Western vets are great. Integrative are Western plus. So it's almost like they have more crayons in their little crayon box, but he's really good.
Nedra, we had a couple questions in the chat. One is, what is a good start for calming?
So depending like on your pup, I usually just like, you want to make sure you're in a calm space and that you yourself are in kind of a calm position, because a lot of times dogs, cats, snakes, they have what's called the Jacobson organ, and it kind of just lives under the roof of the mouth. And it really was designed for them to like find hormones. But because we've integrated with dogs like this, every emotion we have literally has a scent. So if you're angry, you're going to smell one way to them. If you're happy, you're going to smell one way. If you're stressed, you smell one way. If you're anxious. So just, I mean, and that's the thing too, like if you're not in a good space, like just tell your dog, just be like, hey, I'm having a bad day. Because if you're acting one way and you smell a different way, it gets super confusing to them. But just like take a big breath. I mean, you know, just calm down, get in a nice quiet place that isn't too, there aren't a lot of distractions. And then usually I'll start out with the, just like kind of doing that and just like holding for a second and just doing that in a few places, not with a lot of pressure, just to kind of calm down the body. And then you kind of do that Upthrust Stroke to pull. You always kind of are pulling energy down for the most part, unless you're like a dog that's older and you want to stim them. But that's just kind of, you know, a good start for that. And just like see what they tolerate, because you don't want to like force this on them. So like some days they may just be like, oh my God, you can do this to me all day long. Other days they're like, hey, I got stuff to do. So just whatever that is, like honor that and let them kind of lead.
And then do you have any specific tips for cats?
So cats are really interesting little ethereal creatures. One of my cats will sit on me all day long and I can do anything. Like I can play with her paws, I can rub her belly. My other cat is just like, I've got 2 minutes if I'm in. So kind of based on your cat, a lot of times with cats, just because they run, like there's just a lot of energetic to cats and there's a lot of nervy because they're predatory. And so they're always on, like that's just kind of their thing until they like kind of chill out. So if you kind of find them in like a more chill moment, then again, you can just kind of put your hands on them, not for as long and not as hard because they really will pull in heat quickly. And then some cats really like movement. So like you can kind of just do that effleurage again. Normally I stay away from their tummies just because that can really stim like more of an instinctive, and then they kind of like, they start to play and they'll like kind of come at you. But usually like the head for cats a lot of times is really good. The ears on cats, certain cats really doesn't like it, but certain cats really like the tips of their ears rubbed or that can be really calming for them. You're just going to kind of figure out like what works for your cat and then just start with that and just see if you can like extend sessions. If there's something specifically wrong, I use a bit more acupressure with cats versus massage because it's a lighter touch and it's just kind of one part of the cat body versus like kind of running the whole thing. But again, every cat is different. Like certain cats, like one of my cats will just sit on me for forever. And I, literally like we'll do full on massage and she loves it. It just kind of know your cat, I guess, would be, but all this is applicable to cats. So as long as they're okay with it.
And then is there a special massage that you recommend for heart issues?
So heart issues, you want to be really careful depending on what that issue is, because if you have kind of an enlarged heart, you don't want to slow stuff down because you're already having issues pumping. There's specific points that I use for heart issues, which is heart 7, pericardium 7, and pericardium 6 are really good at supporting heart. Depending, with heart issues, you just want to keep your cat really calm. Like that's super important. So a lot of times I may just do like, just something really light. And just see how they're doing. And then a lot of times you can kind of work in the chest area up here just to kind of open this up. But again, you're doing this really lightly. And again, just see how they do with it. There's also CV17, which is an acupressure point, which is right in between their little elbows on the ventral midline. This is a really nice point for like respiration, chi, and heart, and kind of connects with, ancient kidney or kidney lines. So I'll do that one. So heart 7, pericardium 7, it's kind of at the bend of their little wrist. One pericardium 7's on this side, heart 7's on this side. This is a really nice point. It just basically, it's a neutral point for heart. So that works really well. And then pericardium 6 is it's about a finger up, depending on the size, a pinky finger if it's a cat, more of a finger if it's a dog, but right here, and it's kind of in between that little tendon. This point is really helpful as far as for heart issues. It kind of regulates and balances out the heart. So, and that's any heart issue. So those are kind of what I would do. And obviously, if you have actual heart issues like a murmur or whatever, definitely, talk to your vet a little bit about this. And if they're on like Lasix and things like that, you want to take that into consideration if we're going to do massage. So it's kind of on an individual, but the points are pretty safe to use. The massage, we want to talk to your vet to see what that issue is.
And then is there a pressure point to calm down a high energy puppy?
There's a couple you can do. If it's basically, he really hates when I do this, but we'll see. So I just do it's like literally a sweep, but it's like yin tong, GB20, GB17, GB14 is where the collar lies. So it's just like a straight shot, but this really clears brain, calms mind. So I use this a lot with puppies. This is super helpful. The pinchment actually can be super calming just because it kind of gets our little nerves to chill out. And then if they're okay with it, just a really light effleurage on little puppies is really helpful. If they're like ridiculously crazy, you can do gruel tapping. There's also liver 3, if they'll let you do it, is like it's the back paw hind leg, right where like basically where it's in the medial side. So where like your big toe would hit your paw or your foot. Liver 3 kind of in puppies, because they're yawning, like liver energy just shoots up. Like that's the chaos, that's all the crazy. So this kind of does it. So basically instead of shooting up to 100, it shoots up to 50. So this point is a really nice point if they'll let you kind of touch their little paws, just to kind of not allow that energy to come up. And then you can do the yin tong and even like the heart 7, pericardium 7, because that's going to pull energy down. So we just kind of want to balance that for little puppies because they're not really supposed to be balanced, but those are some of the things you can do that should at least help a little bit.
Can you show again the paw, exactly where the paw point that you're showing just now is hard to see.
Okay, so are we talking the liver point?
Yeah, thank you.
So literally, if you have a dog, but so like say this is like my foot. We'll pretend this is my foot. So right here, kind of where my big toe is going to hit my paw, this is liver 3. And so it's on the inside closest to the body, like where your toe is, it's just right there, right on top.
Okay.
So that's a really nice one.
Okay, thank you.
And then Nedra, how long and how often should someone massage their dogs?
That's a really good question. And it's kind of that all again, it depends. If you have kind of an older dog that really kind of likes massage, you can do it every day if you want. I mean, you're obviously not going to use like heavy strokes because If you've got like a younger dog that's an athlete, you probably want to do some things pre and post. So like you just kind of want to do like a light little massage, prior to their dock diving or, fly ball or whatever they're doing, or hiking even. And then when you come back, you want to kind of just, let them cool down, because you don't want them to be too hot. But then you can start just kind of stretching stuff out again, and just kind of notice. A lot of times too, if you kind of hold back here, kind of in that hamstring area, always kind of check, like when they're standing, how that feels. Like, does one side feel bigger than the other side if you're looking at muscles? So if you kind of hold both legs, or you just compare, because that really gives you an indication of something. If one's a lot bigger than the other, something's going on. So that's just a good kind of check. Usually that means there's something kind of up in the spine, or they're not weighting, they're weighting one side way more than the other. And then you want to kind of check the front and see like where their little, humerus and all the muscles are up here, like how that feels. Because dogs, if they're not balanced out, they tend to go on a diagonal. So if this one is really like, if this is a bigger muscle, meaning that this one's not working as well, that usually means that there's an issue over here. And then this one is going to be okay, but you want to make sure you're massaging that out, because it's taking on a load. So, if there's an actual, like, if there's an injury, then, you talk to me or talk to about, and see how often you want to massage. But for the most part, it's, as long as you're not going really deep, it's fairly innocuous, and you can kind of do it nightly if you want. If there's an actual issue, then you kind of want to, do what you need to do, and then just kind of give it 24 hours, and then just kind of see what your dog likes. Because like, I could sit with him literally all day long. He would let me do this. And so, I can, but there's nothing, I mean, this is just good for him. He's, I think, 13 or 14. So I would work on him, as a pet parent, like, every day, if you can, if you want to, or every other day. So it just depends. Like, usually massage can be contraindicated if you have like a pup that has cancer. You definitely want to watch that, because there's certain things you don't want flowing through the body. If they're really sick, like, and they have, you don't want to do massage, because again, we're kind of using the lymphatic system. You don't want to like spread things through the body. You can do, there's something called manual lymphatic drainage, which is a really light stroke, which I will do as long as there's not cancer, pre and post surgery, because that really helps. It builds up the immune system. And then like if you do it afterwards, it kind of helps get the anesthesia and stuff out of the body. And that's a whole, it's a whole different series. But so that would be something, and that you just do, pre and post, and then you're good. So again, it just, that's why it's just important to kind of know what your dog likes, and just allow your dog to kind of tell you what's going on.
Is there a pressure point to improve mood?
There's a couple, depending on kind of what's going on. So the sweep we talked about, the yin tong all the way back, is really good just to open that up. Stomach 36, which is at the very end of the patella on the outside, like right there. Just kind of a little like on us, like there's our patella, and we kind of go over one. That's a really good point. It helps like with stress and anxiety. So we use that one a lot. It just kind of lets that go. What else? If you have a dog that's really fearful, kidney 3 in Chinese medicine, kind of fear is housed in the kidneys. So kidney 3 is right top of the hock fin skin on the inside, and bladder 60 is on the outside. So we just do a little grab, and kidney oversees bone, marrow, opens to the ears. So a lot of times with older dogs, this is a nice point. It also can be calming if they're kind of fear-based. It just kind of allows that to come out. And bladder 60 on the opposite side of that is a pain point or an aspirin point. So there's just, if there's stuff going on, that just, and usually if you're not in pain, you're in a much better space. Another nice one is large intestine 4, which is a really nice calming point, and kind of just lets that out. And that's right, if your pup has a dew claw, it's right on that dew claw, like kind of at the base, and you just do those circles. And if they don't have a dew claw, you just kind of put your finger where the dew claw would be. But that's a really good calming point. It's also a really good immune point. So those are kind of the ones that I would use.
And then is there a massage technique that you would recommend to promote weight loss, specifically in cats?
Pretty much, I think what you're feeding your cat would be part of that situation as well. Stomach 36, though, the one at the end of the patella to the outside, it's a good metabolism point. Like that definitely is what we use to kind of like help speed up metabolism and things like that. It's also good if they have diarrhea, they're throwing up, or they're constipated. So it's just kind of it's like a pumpkin point. But that's a really good point to use, just again for weight loss. But ideally, food is probably going to be your easiest way to kind of get some weight off your cat or what you're feeding.
Nedra, I don't know, I can't remember in the slides, but do you have a diagram with all those pressure points you were just mentioning, just for people to educate themselves on those, or?
Those I don't have in this slideshow. I can send those to you though. You can send them out. I have like kind of an immune one, a calming one, and then immune calming, and like an after workout one. So the points in those kind of help with all that. So I'll just send you, there's 3 different ones. I'll send those to you. You can just send them out.
Perfect, and then I can include that in the follow-up. So everyone will get a PDF of the slides from today, and also I'll include those since Nedra was talking on some of those pressure points so that you can see where specifically they are.
And what they do.
It's hard to see on a big fluffy dog. Are there other questions? You're welcome to drop them in the chat or unmute yourself. And a couple people in the chat were just saying thank you for sending the pressure point guide, because it is interesting to hear you talk about that. And I think people would like to just see exactly where those spots are.
Yeah, no, they're diagrammed out, so that's good. But we can do this on our next class. We'll do acupressure points.
Yeah, if everyone is interested, we can offer an acupressure class at some point too. I think that would tie in nicely with this. All right, well, if there are any other questions you think of, we have one dog has already fallen asleep after a few strokes. Mentioned in the chat. We will, as I said, send out the slides. We'll send out the recording so you can rewatch any parts of it or the whole thing, or share it with someone else. If you had a friend that you know registered and wasn't able to attend, they will also receive the recording and all the handouts and slides. So we will send that to everyone who did register. And then we've been the last couple pet talks sharing our pets. If anyone wants to come on camera and show off your pet, you're welcome to do so. Not required at all, but you're always welcome. It's fun to see. I can change my background so you can see my kitty. I always go the wrong way.
Look at he's really cute too. Aw, look at everybody in their cuteness.
Luca's asleep already.
Oh my goodness.
Aw.
He's got his calm, he doesn't care. He likes his massage better.
Hello.
Aw.
So sweet.
So good. Everybody looks nice and calm and happy.
I know we have lots of calm pets enjoying your presentation. Well, thank you everybody so much for attending, and we will send all that information out to you tomorrow. So have a great rest of your evening. If you think of questions that you weren't able to ask, you can send them to me and I can pass them on to Nedra for you. And I'll also be giving you her website information so you can see what other types of things Nedra does and how you can use her services if you're interested or just learn more about this field. So thank you guys so much for attending, and hopefully we'll see you at another pet talk soon.
Thank you, Amelia. Thank you, Nedra.
Thank you.
Thank you.
Bye.